Okay, here we go. Extremity Pro elbow. Now the elbow is a really interesting joint. It's kind of a glide-glimmus, articulation. So when we look at our schematic, things that we're looking at, number one in our X-ray series, we want to have a lateral and an A to P. Our lateral needs to be at a 90 degrees. And you remember the wrist, thumb up, flat wrist, okay? 90 degrees on our elbow, okay? So we literally can visualize. And remember, X-ray positioning, we want it to be reproducible. So when we get to look at that X-ray, we can see in the image, to absolutely see, oh, that doesn't look normal. And then let's verify it on the patient, because that's real time. So we want to look at not only the angle of the shaft of the humerus, we want to look into the sigmoid sulcus or joint or cavity. We want to look at the capitulum. Are they superimposed? What's the joint space? What's the radial head doing? Do we see the articular surface of the radial head? Are the radial tuberosities greatly shown? The greater that you see that, the more the laterality that there is. And we'll talk about that in a second. So all these things we're evaluating, but mostly joint space. Is it equal joint space all the way around? Is it open at the back? Or is it closed at the back, indicating certain misalignments? Are we seeing the head of the humerus 1 to 2